morning.
Hey there, I'm here for an assessment.
Assessment of mental health or substance use?
I guess I'll do mental health today.
All right. Go ahead and take a look through this. You can fill some of that out, and I will let someone know that you're here.
Okay, thank you.
Hey, Lucy.
Hi.
Hi, my name is Charlotte, and I will be conducting your intake today. As soon as you're done with all your paperwork, let the front desk know, and I'll be back out to get you so we can get started. I also want to let you know that it's very important that you fill out the screens and the tools as accurately as possible so that we can come up with the correct diagnoses as well as know what interventions to use. Okay?
Gotcha.
So as soon as you're done, let them know, and I'll be back out to get you.
Okay, thank you very much.
So Lucy, those are all the questions I have for you. And based on our conversation, as well as the screening tool that you completed, I diagnosed you with generalized anxiety. As you can see, you scored a 16, which puts you at moderate to severe as far as in the symptoms. Do you have any questions in regards to that diagnosis?
No.
I also noticed, though, that you also scored high on your drug screen. Okay? You have a 7. And so what I would like to do is, when I take you to the care coordinator, that when I take you to there, I'm going to make note of that so they can provide you with some information and discuss with you some treatment options. Because with substance use, that can sometimes make mental health symptoms worse. So I think it would be good to include that into the treatment plan. Okay. Do you have any questions in regards to that?
No.
Okay, so I will go ahead and walk you down the hall to care coordination where they will complete your treatment plan.
Okay.
Okay?
Thank you.
You're welcome. Devin,
Yeah, hi.
this is Lucy.
Hey.
Hi, Lucy. I'm
just
Devin.
completed our
Nice to meet you.
intake.
Me too.
Here's her paperwork for the treatment planning,
Okay, great.
and you're in good hands.
Awesome.
Good luck with everything, and thanks for coming in.
Thanks,
You're
Charlotte.
welcome.
All right, thank you, Lucy, for joining me. Like I said, my name is Devin. I'm going to be your care coordinator.
What's a care coordinator?
Great, I'm glad you asked. A care coordinator is going to be the person that helps you get connected to services here at Valley Cities. So if you're interested in medication management, meeting with a clinician, or maybe it's groups or peer services, those are all the things that I can help you schedule and get referred to. Okay. When you have time, I would recommend maybe going over this pamphlet at home. It gives you a better description about what these services offer and kind of more details about what they can provide. And if you want, you can give me a call after today and we can get you referred to those services.
Gotcha.
Great. Do you have any other questions before we kind of dive into this paperwork?
No.
Okay. Well, I wanted to thank you real quick, too, for filling out all this paperwork. I know it feels like a lot sometimes when you're coming in for services. And I know that you also came in today for mental health services, but we do ask everyone to complete paperwork related to substance use as well. Did you have any questions about these forms?
No.
Okay. Well, if it's okay with you, I'm going to pick out one of these forms about your substance use and to go in depth a little bit more about them. Okay? Great. So this form here that you completed is going to be asking you questions about your drug use. All right? And so you scored a 2 out of a 10. So I can tell you a little bit more about what that score means. Did you have any questions so far? Okay. Did the intake specialist tell you a little bit about what your score meant?
No, she just explained that you were going to go over it with me so we could review what my options are.
Okay, yeah, so let's do that. I'm going to plug in your score into our intake right now and tell you kind of what that means. So a score of 2 on this tool, on the DOST, kind of places you in the risky level, okay? So do you have any knowledge already about kind of what a risky level would mean?
No, I don't think I am risky.
Okay, and why do you say that?
Because I just, marijuana is not a harmful drug. It's natural.
Right, and I definitely get that a lot, and people do have their personal benefits of using, but can I tell you a little bit more about what the risky category means and how that could impact you?
Yeah.
Okay, thank you. So this form I'm going to show you is going to be a diagram about marijuana and the effects on the body. So I know you mentioned that it's natural and it's something that you feel like doesn't have any serious effects maybe on the body, but I just want to talk to you a little bit about some of these and maybe highlight things that could be potential risks for you. Okay? So some things that I like to point out, and these are things that could impact anyone who's using marijuana, is it could be or weaken your immune system. It could cause respiratory problems. And if you look up here, it also has some impact on your mental health symptoms as well. So including anxiety or depression and sometimes a lack of motivation.
I just feel like it helps with my anxiety because like I have a hard time like going to big public areas with a lot of people, and that's why I like to smoke before I go, because then it doesn't feel so intense.
Okay, so it sounds like, you know, that kind of helps you with your social anxiety, it sounds like. But then you also did mention maybe a risk factor is when you smoke before you leave to go out of the home. How do you get places?
Oh. Well, I guess it depends. I guess like I can catch a ride with somebody or I just take the bus.
Okay. So you are keeping yourself and others safe then by not
Yeah.
driving.
Yeah.
Okay. Because that is also a risk factor that they put here. So it sounds like you are being conscious about your use. Okay. Did you have, I mean, were you aware of any of these side effects before?
Well, I guess I definitely have issues with like memory. Like I can't remember a lot of things, and when you said lack of motivation, I feel like I do have a difficult time like wanting to go do things or wanting to go like walk my dogs, and yeah, I just want to just watch television pretty much all day and eat.
Okay. Yeah. So it sounds like your substance use and using marijuana is impacting your ability to complete your goals or even like your day-to-day tasks.
Yeah, I would say my day-to-day tasks.
Okay. So then on a scale of 1 to 10, 1 or 0, excuse me, is not at all, or 10 is very. On a scale of 1 to 10, how important is it for you to change your use?
I would say, let's see. I guess I would make it a 5 because like I don't really want to quit, but I do recognize that it does cost. It's pretty pricey.
Okay. So cost and financial stressors sounds like it could be an important reason why you would want to reduce your risk. I think that's great that you recognize that. So why would you say a 5 and not a 4?
I guess because I'm getting older and it's kind of like I really shouldn't be leaning on that to help me through my anxiety.
Okay. Yeah. That's great. I feel like you've already recognized your own personal motivation on some parts of why you would want to change your use. And that's definitely what we're here to help you do. So what we'll do is we'll put this in your treatment plan so that your care team can support you and help you meet your goal of maybe reducing your use. Okay. So what would reducing your use look like for you?
Let's see. I mean, I smoke, like, I pretty much smoke every day. Like, or I usually smoke like when I have to go somewhere, like whether it's grocery shopping. So if I'm staying at home, I don't smoke as much. So I don't know what it would look like. I guess it would just, I don't know.
Okay. Well, let's look over here at the DUST, the tool that we used. It kind of assesses how often you use and any impacts that you have. So you said that you're using daily at this time, right?
Yeah.
Okay. And you scored a 2 right now. If we gave you this assessment in like 6 months, what would you want your score to look like?
1.
Okay. So how would you get it to a 1 then?
0.
Or a 1 or a 0?
I would just have to smoke less pot, pretty much.
Great. And then on a scale of 1 to 10, how confident are you that you can do that?
Not very confident.
No?
Well, I haven't really tried before. I mean,
Okay.
I've just, I've been smoking for quite a while, and And then pretty much everybody that I hang out with, they also smoke pot, and it's legal here in Washington State, so it's like the temptation is right in my face.
Yeah.
Yeah, I don't feel very confident.
Okay. What do you feel like we could help support you, or what do you feel like are some changes that you can make to increase your confidence?
Well, I guess I do pretty good with accountability. Like if I have, I don't know, I guess like if I have people like on my team that are aware of it and check in with me, like, you know, if I've cut down or not, that gives me a little bit of accountability.
Okay, and that's definitely what we'll be able to provide for you. We'll get you connected to services like meeting with a clinician. We'll get, if you're interested in coming in on a regular schedule, the things that we'll put in your treatment plan today related to your substance use is what we'll document on and review when you come in each time to kind of track your progress and help you keep your accountability on that.
Sure.
Great. So my last question here is, a score of 1 to 10, how ready are you to make a change in your drug use?
7.
7.
Yeah. Let's just do it.
Okay. I think that's great. So let's start there then. Let's put in your treatment plan then that you're interested in reducing your use. So you said you're using right now daily. So what would be a first good step in reducing your use? How many days a week would you want to try to use instead of every day?
I guess every other day sounds reasonable.
Every other day? Yeah. Okay. All right. So that's essentially reducing it by half?
Yeah.
Okay. All right. Great. So let's put that in your treatment plan. And then what we'll do next is we'll get you scheduled for some appointments. All right?
Cool.
All right. Do you have any questions for me?
No, I guess that's it.
Okay.
Yeah.
All right. Thanks, Lucy.
Yeah, thanks.
Hi, Lily. Thanks for coming in. Everyone at Valley Cities receives a care coordinator, and I'll be your care coordinator. I can help you with resource needs, so if you need anything related to housing or employment services, if those are relevant, I'll be your point person for that, and I can point you in the right direction. And I can also help change any of your care here at Valley Cities. So if you want to switch clinicians or something like that, or get a different type of service, then I'll be the person you contact for that as well. And during this next part of the intake, the last little bit, it'll just be talking a little bit about your drugs and alcohol use, creating a treatment plan, and going over some resource needs. All right, great. And during this first part, we'll be talking a little bit about your drug and alcohol use. So it's something we ask of all of our clients. We just like to get to know a little bit more about how people use and see if there's any way that we can help. Would it be all right if we talk about that now?
Sure, I guess.
All right, great. If we look here, so from the questionnaires you just did, it looks like you have maybe 5 or 6 drinks 4 or more times a week. Does that sound about right? So like 20 or so a week?
Yeah, give or take.
All right, and what quantity or what kind of drink do you usually drink?
I normally drink wine.
Okay, just your standard glass of red wine or something.
Yeah.
And this is a diagram. It kind of breaks down the entire population of the U.S. in terms of the amount of risk they can get for the amount they drink based on how many drinks they have. So the bottom is the low risk or abstaining. So in order to do that, women have to drink 7 alcoholic drinks or less a week. And unfortunately, the amount that you reported puts you at the top 5%, which is the dependent range. And what that tells us is that you may be more likely to have a lot more harmful effects to your health and to your life. Does any of that surprise you?
A little bit, but okay, it's all right.
Well, here I have a diagram. So this shows some of the possible effects that risky or harmful drinking can have on someone. So you came in here for a mental health intake, and actually it might not seem like alcohol affects you that much, but it can actually exacerbate a lot of the symptoms you have in relating to your mental health. And there's also a lot of other things, like you can be at increased risk of heart disease or liver issues and diabetes. And also it can affect your life, like DUIs and stuff like that, legal issues. People might be concerned at the amount you drink or maybe want you to drink less. And it could strain your relationships. So based on that, what concerns do you have? Have you noticed any of these in your life, or what concerns
Well, I
do you
drink
have?
a little more when I'm sad. I think it helps. It helps. I think it helps me not to think about the fact that, I don't really feel like doing anything anymore. I have some health issues. I have diabetes now, and my doctor says that drinking's not helping that. And so, my family's really on my case about it. And so now I pretty much hide from them. So, all in all, it's really not making my life any better. But I just don't know what to do about it.
Okay, so it sounds like it is starting to really affect your life. You mentioned diabetes, and that's definitely really hard to control when you have maybe higher levels of drinking, and it is affecting your relationships, you said. So, and it sounds like you're kind of realizing that it's not super great in your life. Have you thought about quitting or reducing? What are some of the barriers you feel are in the way to that?
Well, I've thought about it, but what else am I going to do? I mean, if I don't drink, I just sit around and cry all the time, or, I don't feel like doing anything if I don't have a couple of glasses of wine, or, if I have a couple of glasses of wine, then I want to go out and I want to hang out, I want to go out and be around people. If I don't, I just want to go to bed.
Okay. So despite you starting to have these relationship issues and problems with your health, it does help you a lot because you do want to do things and it makes you have more fun. Is that right?
Yeah.
So I have here a number graph on a scale from 1 being not at all and 10 being very. How important is it for you to change the way you drink or work towards changing the amount that you drink?
I guess maybe a 5. I'd like to see my family again. I'd like to be healthier.
All right.
Yeah.
That's awesome. So why a 5 and not, say, a 2 or a 3?
I really need to do something. My family's pretty important, and my doctor's really on my case. Plus, I'm just sick and tired of feeling this way.
All right. So it sounds like you have some pretty strong reason, even if it's still kind of scary and you still see some benefit. But how likely Or I guess how confident do you think you are? 1 being not at all and 10 being very.
That's probably going to be more like about a 3 or a 4.
Okay, that's still good. Why a 3 or a 4 and not a 1?
Because I could say it, but when it comes down to it, I can say that I'm going to walk out of here and not drink anymore. But, I live alone, and when I'm sad and I don't have any energy to do anything, and I do have a bottle of wine, then I don't know of anybody who's going to stop me.
Okay. Well, luckily for you, it's really great that you're taking the first steps into getting your mental health taken care of. So your clinician for behavioral health services will be able to help you work through a lot of the issues of depression you were talking to me about and how that relates to your drinking. We also offer substance use disorder treatment services, and it's pretty similar to the mental health services. It'll help you explore a lot of these issues of ambivalence that you're feeling right now. So, would you be interested in an SUD assessment? We actually offer those. We have walk-ins. You can get them next Tuesday, but we have them today if you want.
Sure.
All right, great. I'll add that to your treatment plan. And would you be all right with a follow-up appointment, let's say in 2 weeks, so we can kind of go over your progress and how you're feeling? Great.
And you're going to schedule that today? Okay.
Yeah. All right, then we can actually walk over to your SUD assessment right now if you're okay.
Okay.
All
Okay.
right. Great.
So Naomi, I wanted to talk to you about care coordinators. We've gone over your assessment, your intake and treatment goals, and at Valley Cities we have care coordinators that will help you transition into the services that you need.
Okay.
So based on what we've talked about, care coordinator would help with the referral into withdrawal management services and help you with transportation, and then help you with the mental health services. So if you don't mind, I'm going to call Krista and have her come in and kind of introduce the services that she can help you with and to navigate that system. Okay. Are you comfortable
And that's
with that?
detox, right?
Yeah, it'll be
Okay.
detox, it'll be referral to med providers, mental health services,
Okay.
that type of stuff. Okay, she'll be in just a moment. Okay.
Hi, Krista. I'm Naomi.
Naomi, nice to meet you.
Hi, Krista.
So, I know you've been talking with Kat about your substance use, and I think I understand you'll be going to withdrawal management services and then to inpatient after that.
Yeah.
Okay, all right. And so, what are some of the things you guys talked about that you'll need to do before you get there?
Yeah. Well, I need transportation. I also, we talked a little bit about my scores on with the anxiety and depression. So I really had a hard time with that, and that's a lot of the reason why I'm using
Okay.
and drinking is because when I feel depressed, that's what I do, and then I get anxious, and so it's just this revolving door, and it's really led me to a really bad place in my life right now.
Sure, absolutely. So it sounds like you might be interested then in enrolling in our mental health services.
If that's what's going to help with that, yeah.
Sure. Yeah. So let me back up. I know you talked about transportation.
Yeah.
So with the process with getting into the withdrawal management services, we'll first need to make sure that you get your physical screening done with like a primary care physician.
I don't have a doctor.
You don't have a doctor. Okay, and that's all right because what my role can be to help you with that is we can make some phone calls together.
Okay.
And see if we can get you scheduled in somewhere, and we'll give you the paperwork that you'll need to take with you and all of that to finish that.
So you'll help me find a doctor?
Absolutely.
Oh,
We'll
okay.
help you
Oh,
find
nice.
a doctor. We'll help you get the paperwork all settled for you to take to them, and they can do that physical screening for you, and then we'll go from there to get you into the withdrawal management services, and we'll help with the transportation as well. So that way, that's not something that's weighing on you that you have to worry about. We'll definitely be supportive with that.
Okay.
And then as far as the mental health piece, we definitely take a team approach here at Valley Cities. So as a care coordinator, my job is to help you with referrals and resources both in the agency and the community.
Okay.
And then we also have, psychiatry services if there's a need you feel like you might have for mental health medications. And then we also have therapy, and we also provide peer support. And what that is people who have been through their own journey of recovery, and they're there to kind of walk with you through your own recovery, and they've made it to the other side, so they're there to be supportive and give you hope, for your journey as
They get it, right?
Yeah, exactly. So those are all things we can provide through our mental health services. So I know you're planning on going to inpatient soon.
Yeah.
So we can kind of work with your schedule of when that will happen, because there are a couple things you need to do first before you get there. But we could even schedule, if you'd like, that mental health intake soon, and then that way those things would be set up for when you get out of inpatient. And,
So
come back.
detox, no, primary care, detox, and then treatment, and then mental health.
Yes, exactly. Kind of in that order.
Okay.
We will we'll be here for when you get out and be able to support you with that mental health. You mentioned that's it's hard for you to kind of deal with your anxiety and depression.
Yeah.
And so if we can find better ways to do that for you than the substance, we want to support you in that.
Yeah.
So, yeah.
Thank you. Okay.
Absolutely. So.
Do you have any questions right now about the process?
No, I think it's pretty clear.
Okay.
Thank you so much.
Yeah, absolutely. So, if you are done with this part, Kat, I think we could transition to my office if that's okay with you, and we can work on getting those things set up for you.
Okay.
All right.
Perfect.
Thanks.
Thank you.